Hi, my name is Joe Legrand. I'm here to give you a really brief intro to drug terminology. We're going to use this board as the way we're going to walk through this, starting off with the concept of an NDC. So some of you might know what an NDC is, but it stands for National Drug Codes. They're on pretty much every prescription that gets filled in a pharmacy, and there are 3 segments to each NDC. So there's the first one is a manufacturer. Who makes the drug. They have a code that identifies them. Second one is the product, and that product we'll talk about in just a second as the most important thing for this topic. And the last one is pack size. So does it come in 90 tablets, 100 tablets, 30 tablets, milliliters, whatever the pack size is. And these are, I believe, basically registered with the FDA by the manufacturer, and there's a lot of stuff that goes into it. But the important thing to know is each of those segments means something different. So taking the product segment into consideration first, the product segment, the middle one, represents 3 things: ingredients, so in this case, lisinopril and hydrochlorothiazide, dose form, tablets, and then strength. So that would be 10 milligram over 12.5 milligram. Making this more general, we can see that this product, lisinopril hydrochlorothiazide tablets, 10 milligram, 12.5 milligram, represents more than just an NDC. It represents these 3 different products from 3 different manufacturers with different pack sizes in some situations. And you can see that the middle numbers in all of these NDCs are different. So they're not standardized at all between different manufacturers. So if you were trying to figure out, just by looking at the NDC, whether or not this was a lisinopril or hydrochlorothiazide product, it would be very difficult to do that. So that's the problem with NDCs, among other things, but this is where we introduce RxNorm. So RxNorm can take all 3 of those NDCs and normalize them, hence RxNorm. So we've got an example here of an RxNorm code for this particular product that we're just looking at. So it has 3 different, the main thing here is RxQE identifier made by RxNorm, which means concept unique identifier. That's the 197885. It also has a just normalized way to represent the product in just words. So that's the STR, or the string description. So they do it, I think, alphabetically. So hydrochlorothiazide's first, and then lisinopril, because everything's got to be super normalized. And then the last thing is the term type, or TTY. In this case, it's called a semantic clinical drug, or SCD, because RxNorm has lots of different levels of kind of hierarchy of ways to represent a product. So in this case, we can see that in the text that it's 12.5 milligram and 10 milligram, and there's 2 ingredients, but RxNorm is really handy because it actually breaks these things down into other codes. So this drug product, or SCD, contains a multiple ingredient code that represents the hydrochlorothiazide lisinopril 2 ingredients together. So that's the MIN. So this drug product, or semantic clinical drug, has ingredients of hydrochlorothiazide lisinopril. Going down a step further, that multiple ingredient code has 2 individual ingredients, or IN codes, for lisinopril and hydrochlorothiazide. And then using RxNorm, you can also figure out that for this product, the lisinopril ingredient is a 10 milligram strength for this product, and then a hydrochlorothiazide ingredient is 12.5 milligrams for this product. It has other relationships with other things. So in this case, has a dose form of a oral tablet, which also has its own identifier. And that oral tablet is a oral product. So if you wanted to perhaps group multiple different oral products like tablets and capsules and other things together, RxNorm also has kind of a hierarchy where you can group by that dose form group, basically. So at a high level, hopefully you've seen that NDCs is one way to identify a drug product, but it quickly breaks down if you're trying to look at a bunch of products or do kind of work with them for decision support or anything like that. So RxNorm is a useful drug terminology ontology that can be used in conjunction with NDC to do things that we'll talk about later. RxNorm is one example. Other commercial drug databases exist to do similar things, but we're going to focus on RxNorm because it's an open standard that everybody can use. So we'll see you next time for the next video.